Hello to my mature modern mavens. Welcome to Womanhood Wednesday. I am Tracy Byerly and I am unapologetically great. I help women to create a confident, prosperous attitude about growing older so they can master the art of aging unapologetically. Welcome, welcome, welcome from all areas. By the way, I have to put in this plug. Wherever there is to subscribe, please subscribe, hit the little bell, and select all so you always know when we're going live, be it Facebook or YouTube. And we do have the private Facebook page, Prosperous Pro Aging Women. That's where all of the conversation takes place in between, and this is a little bit of different platform for me. So thank you for your patience in advance. And then there are some of you that are looking at, and you might be like, did she cut her hair? No, I have to show you guys. So what I'm doing is working on my protective style for my hair. Yes, I did this by myself. No mirror, no comb, but it helps keep the ends protected. I know you didn't want to hear all about me. You want to hear all about our special guest that is going to be here with us today, and I'm so excited. Let me tell you about Dr. Andrea Palmer. She is an Oklahoma native turned Texan in 2016 when her family moved to Fort Worth, Texas. Growing up the granddaughter and niece of surgeons, her decision to become a physician came early in life. Having wonderful, strong female role models throughout her life has given her a passion for working with and caring for women, making I butcher that all the time, obstetrics, OBGYN. Y'all know what that means. Anyway, a natural career for her. She has a true love for obstetrics and operating. She cherishes sharing the experiences of pregnancy and the joys of bringing new life into a family. She also enjoys the ability to care for her patients throughout all stages of life. Gynecology gives her the opportunity to have that continuity of caring from adolescence through menopause. She has a special interest in robotic surgery and has had the privilege to help other surgeons with several. Hold on, y'all, get it right. She has attended several advanced training programs through the Da Vinci surgical program, and she is privileged to help other surgeons master the technique. And I don't mind repeating that again because I butchered it. She has a special interest in robotic surgery and has attended several advanced training programs with the Da Vinci surgical team, and she's privileged to have helped other surgeons master the technique. She strives to educate her patients and establish a trusting, lasting relationship. The more she knows about their health, history, and families and personal preferences, the better she can care for them. So if y'all are needing an OBGYN in the Dallas Fort Worth Metroplex, she is in Fort Worth. She graduated magna cum laude from University of Oklahoma and attended medical school and residency at OU Health Sciences Center, where she served as chief resident. She practiced in Oklahoma City at Lakeside Women's Hospital, where she served as chief of staff for 7 years before moving to the great state of Texas. She is married to another busy physician, and they have 2 school age children. She now practices with Phenom Women's Care at Baylor All Saints in Fort Worth. I want y'all to give it up to my friend, Dr. Andrea Palmer. Yay!
Hi, thank you so much for having me back. I'm so glad to be with you.
Look, we're happy to have you back too. You're back by popular demand. I
Well,
love it.
good.
Hmm. All right. Before we jump into perimenopause and
Mm.
beyond, what's a fun fact about you?
So, my fun fact, you said in my bio that I've wanted to be a physician since I was a kid, and that is the absolute truth. But there were times in college when, studying was not as fun as some of the things my other friends were doing. And so I tried to develop like what was going to be my plan B, like if medicine didn't work out and I decided not to go down that path. So my plan B, I was going to move to New York City and be a rocket.
Whoa! Oh my goodness.
Um, it turns out, though, I'm actually too tall to be a rocket. The height limit at that, I haven't researched this in a good 20 years, but you couldn't used to be taller than 5'9", and I'm 5'11", so I was too tall.
Oh,
So
wow.
it had to be medicine because obviously the rockets weren't going to work out.
Nope. You were needed
No.
right here in Texas. That is so cool to know. Well, you are going to talk about the common sense of perimenopause. Talk to
Yeah.
us.
So, I get questions on a daily basis in clinic of, am I in perimenopause? Is this perimenopause? Can you draw a lab to tell me if I'm in perimenopause? Sorry, dog hair somewhere. And so just wanted to talk about kind of the common things that we see, that we encounter when we're moving through this perimenopausal period, kind of when we can expect these things to happen on average. So, the first thing that most people are going to notice is that your periods can become irregular. Now, a lot of people just think, "Oh, menopause, my period stops." But the thing that actually happens for most people is an irregularity of your cycle occurs before it goes away. And that can look really different. Sometimes that can be skipping periods. Sometimes that periods can actually get closer together. And oftentimes that like moving shorter together cycle from first day to first day happens first and then they start to space out. So it's not so intuitive or not such common sense that the periods may get closer before they get farther, but that definitely is a pretty normal thing that happens. And that's just, it's all due to the increased level of hormones it takes our brain to talk to our ovaries, and then they kind of overshoot. And but so yeah, oftentimes periods may get closer before they get further and before they leave.
Wow.
Yeah. So a lot of people um, don't really know that. Um, Along with these kind of more irregularly timed periods, we may get a little bit more significant symptoms of things like PMS. So I yesterday had a patient in, she was in her early 40s. She said, I have been having periods my entire life and never have I ever had just these intense emotional symptoms like I've just started having over the past 6 months. And there can be many reasons for that. We may have underlying anxiety or depression or underlying mood disorders or some trauma going on or stress or, hello, we're still in a pandemic and, the world can be a scary and stressful place. And that can sometimes intensify the things that normally wouldn't be as intense. But
Mm-hmm.
it's not uncommon as the swings of our hormone get a little bit more substantial, um, that the symptoms of our periods may get a little worse. And so, worsening PMS, some women will start to get a little bit of hot flashing and night sweating, especially in that PMS period. So, period hits the first couple weeks, you're really doing fine, and then ovulation happens, and it's just off. Off the charts. And so intensity of symptoms can increase as well as, again, starting to creep in with some of those hot flashes, pardon me, and night sweats. Along with that, sleep sometimes is not so great in the perimenopausal period. Not sleeping, again, when we also talk about maybe some underlying anxieties or maybe some underlying mood issues or maybe underlying stress, and for I always ask when we're like, I'm not sleeping well. Is it I can't fall asleep or I can't stay asleep? And 99% of people who are in the perimenopausal age say both. You can't fall asleep because your mind is rushing 99 miles an hour, and that's the world. But then you fall asleep, but then you wake up drenched in sweat, and the game the game is over at that point. So the hot flashes and night sweats can definitely make that worse. And bad sleep leads to a bad mood. And so mood disorders like anxiety and depression can be even more prominent in the perimenopausal period because of all these other factors
Hmm.
that really kind of compound um, the stress on your body and diminish those neurotransmitters in our brain that we need to, look at the world in the way that we always have. And so mood changes can be a pretty significant part of it for some people. Again, some of that's cyclic, some of it's kind of a consistent thing. Um, our fertility decreases as we move through perimenopause. That's a pretty common sense thing. But there are still women out there who are like, oh no, I'm going to wait to have kids till I'm like, I don't know, 42 or 43. And I always caution people, although we deliver healthy babies to healthy moms in their 40s, um, your ability to get pregnant per cycle every year decreases. And so if you are somebody who's wanting to really, delay kid having until your 40s, just know that like without help, that can be kind of a tricky thing. Um, and so if that is something, um, you know, if we have women on here who um, still have child having goals, like come see us sooner rather than
I
later.
just saw a comment where somebody said, "This is great info, shedding light on how I've already moved into this season." By the way, I'm going to tell you, if you haven't clicked the StreamYard link, I promise it'll bring you back. Please do that so we can see who you are. Otherwise, it just says Facebook user. All right, so go ahead. You do have
Yeah.
somebody who's in there that did say.
Fantastic. And it's not like the ship has sailed and will never come back, but like certainly it gets harder. And if you're truly wanting to pursue pregnancy and maybe you've been trying for over a year, like do not wait around. Like there are things that we can do to help. So definitely if that's something that's on your radar, come talk to us sooner rather than later, because time is a very precious thing when you're talking about eggs and in our 40s. So, um, and along with that decreasing fertility, when we talk about, things like evolution and how our bodies are supposed to work, sexual dysfunction can come along with all of these hormonal changes that occur in the perimenopausal area. So we're talking about vaginal dryness, decreased lubrication. Some of us may start to have some bladder issues that maybe weren't there before, with leaking urine and such. And so all of these things, again, just the bigger fluctuations that we have in our hormones, the overall lower amounts of estrogen that we have in this part of life, can really cause some pain with sex. Again, orgasms may not be as easily achieved. And definitely, again, lubrication can be an issue for a lot of people. From a health standpoint, we think about things like bone loss and osteoporosis starting to increase as we lose our natural levels of estrogen, as well as changes in things like our cholesterol. Back, Lord, 30 years ago at this point, kind of the common um, thought process was that estrogen was kind of this fountain of youth. And when you look at women and men who are the same age, before menopause, women have a lower cardiovascular risk for things like heart attack and stroke compared to men at the same age. But when you
Mhm.
move past menopause, our heart disease risk goes up to meet that of a man. And so forever and ever we thought, oh, it must be the estrogen must be protective against our heart for some reason. Um, and they actually did a huge, beautifully designed study on this with tens of thousands of women. One of the few studies, and this is another talk for another day, that women are very underrepresented in the world of medical data in the world of medical studies. We have been excluded for years because of risk of pregnancy, and nobody likes to do testing on pregnant women. That's not a thing that a lot of companies want to sign up for. But the study called the Women's Health Initiative, and then there was the women's nurses study that was similar. But again, tens of thousands of women, and they gave everybody hormones because they were going to cure your heart disease and prevent heart disease, and they were going to do all these amazing things. And this is actually done by a drug company just to show like how great their product was and how many lives they were going to save by giving everybody estrogen. Of course, turns out that exogenous estrogen, so hormone tablets that we give people, actually do increase cardiovascular risk. They increase the risk of heart attack and stroke. But now we know this data, and I always caution that data. It's this data wasn't done on perimenopausal women. This was done on women in their 60s. And so the extrapolating that to somebody 20 years younger, I think is a bigger leap. And we now have, and we know that there are hormone treatments, for example, that we can give, like transdermal estrogen, so estrogen through gels, patches, or rings that we know have a lower cardiovascular risk associated with them. But it is not the protective fountain of youth that we had once thought.
Wow. If you can see that emoji with the little head just went. We got a yikes on here too. Uh-huh.
Right?
Wow. Mm-mm-mm.
Yeah.
Wow.
Yeah, so those are kind of like the things to just be looking out for, the things to think about. If you're experiencing any of these things, as far as the symptoms go, and they're bothersome to you, then that's when you come and talk to us. And the other thing is we don't have to pathologize everything, right? Like this is a natural process, and for some women, this is not a bothersome thing. Maybe their periods get a little wacky, maybe they get a little hot and sweaty at some points in time. But for a lot of women, this just happens and they're fine and they can still, comfortably enjoy sex with their partner. And life is just fine, but their periods are a little off. And yeah, again, maybe they're a little hot sometimes. And oh, wow, I haven't had a period for 6 months. Look at that. So if that is you, that is amazing. And do not feel like you are having to fix something that's not broken. And so if you're doing fine with this, then that is amazing and you are lucky and you just keep on keeping on. When we want you to come do something about it is when it's impacting your life, when it is impacting your relationship, when it's impacting your mood and your sleep and your work and your life, all of those things. That's when there are things to do. And I know Tracy and you and I have talked about some of the herbal things. I know you're a huge maca root, right, fan? And so there are
Yes.
definitely some herbal options out there. There are some over-the-counter things like estrogen and soy-based products that could be helpful for some people who are kind of wanting to avoid traditional hormone therapy or to, go a more herbal or natural route. So, it's not all pushing pills. There's lots of other things that we can talk about as good options.
We have a question. Can you talk about the herbal natural remedies for some of these issues?
Yeah, so there's a bunch of things out there that will tout themselves as helpful. And the unfortunate part about herbal remedies is that we don't have data, right? Like I'm a science-driven, data-driven brain. That's just how mine works. And
Yeah.
so when I talk to patients, I can quote you the statistics from the Women's Health Initiative study. I can tell you the likelihood that this is going to cause that and that is going to cause this. But the problem with herbal supplements is that we don't know statistically the good and the bad. There are a lot of products out there. Again, the maca products are, I think, big in the menopause relief sphere. People will talk about. Oh, sorry, my brain has just left my thought process. Hold on. Sorry, it's just a brain fart.
And we'll bring it back. And no,
We'll bring
it
it
ain't
back.
old
Yes.
age for whoever's watching.
Right.
That's not it. She's a busy doctor. Please and thank you.
But again, there are over the counter products. People will talk about compounded things and bioidentical hormones as all kind of you know. More natural approach to medically treating menopause symptoms. Ashwanda root, sorry, that's what I was thinking of, has some, again, some properties that may be helpful. A lot of soy-based things get converted to what we call phytoestrogens and estrogens in our body. And so for some people that can be a helpful thing for the hot flashy kind of night sweaty symptoms. When you're thinking about vaginal symptoms, over the counter there are products like Replens, which are just vaginal lubricants and moisturizers. Coconut oil can be largely helpful for a lot of women, and I definitely have a lot of people who rely on that. I used to have an attending that used to really advocate for Crisco as a lubricant for during sex. he was like, he was like, I've never had anybody complain. I'm like, all right, Dr. Quinn, I believe you, but coconut oil, I do think can be really helpful for moisturization and lubrication for some people. But yeah, there's definitely lots of good options out there that aren't necessarily prescriptive. So
you can't see the emojis that are coming.
You didn't know we were going to talk about Crisco today.
We got that wow emojis is sitting up here on top of this screen. Oh, this is so fun. I love talking to you. Oh my gosh. So when to expect
right yeah,
unexpected.
exactly, because we don't know what's going to happen for everybody, right? That's the thing. Like, your experience is going to be different from my experience, is going to be different from anybody else's, because we are all lovely individual people. It isn't that the greatest thing. So we don't know what to expect, but can we figure out when we might expect it? So just like everything, genetics can have a part in this. And so if when your mom started going through menopause or went through menopause, then that's a fairly good gauge for you. So if your mom was 50, then 50 is a reasonable expectation for when menopause, periods will go away. Some lifestyle factors will affect onset of menopause as well. So again, we have genetics. Smokers, people who use tobacco, are more likely to go through menopause early. And so lifetime smoking can bring menopause on up to 5 years earlier for some women.
Wow.
So that's a huge influence there. For women who've had a hysterectomy, even if you had your ovaries in, some data shows that maybe a year or two sooner than you would have lost ovarian function, but I think that's kind of wishy-washy data, honestly. My firm belief is that if you have one ovary, it does just as good a job as two, so I don't think that truly impairs your lifelong ovarian function. But so average age of menopause, so periods gone, is 51 and a half.
Okay.
Menopause symptoms, perimenopause, this whole process can be up to 5 to 10 years for some people, right? So some people will start having symptoms in their early 40s, but not lose their cycle for a good 10 years. 5 years of symptoms is kind of typical. So it can be, and again, some people, they're not bothersome. It's not a big deal. And so there's nothing that we have to do about it. But for some women, this, truly symptomatic and problematic symptoms can happen, again, starting in our early to mid 40s.
Mm-hmm. We have a comment. This is why it's helpful to talk to your female family members. Sadly,
Yes.
This doesn't happen a lot. Mm-hmm.
It doesn't happen. And I think that times are changing, which is great. But if I would have asked, my grandma, we called her Chi-Chi. If I would have asked Chi-Chi when she went through menopause, she would be, that's not something ladies discuss. So I think that you don't know how many patients I have whose grandmothers, for example, might have had breast cancer or uterine cancer or some kind. And I go, well, can you tell me more about that? Do you know what kind it was? Do you know if they had gene testing? Do you know if they had a mastectomy? Any of these things? And she goes, oh, well, she would never talk about it. And so I do think that times are changing. And I think that we can start by modeling for our kids what good communication about our health looks like, and good communication about their future risk looks like.
Yes.
And by encouraging our mothers, if they're still alive, and our fathers, our parents, to be more transparent with their health histories.
Yes.
because I definitely, family history and genetics are so strong in so many factors of our health. And so trying to like draw those painful conversations out is worth it because, yes, no, there is definitely a generation of, we don't talk about that. That's not, proper conversation to have around the dinner table. That's, so it is definitely, yeah, we will do better about this for our kids and our grandkids than our grandparents were willing
Absolutely.
to do for us. Yeah.
Mm,
So
mm. Well, that brings us to something I'm sure everybody's going to want to know. Options for relief. We did
yes.
talk about
So
some.
we touched on some of these. I want to think about some of the like non-medical like lifestyle things that we can do. So first of all, well, for the irregular periods, there's really only hormones like birth control and things like that are options, and that's something that again is safe for most people just based on your health status. Again, come talk if timing of periods is problematic for you. um, for the hot flashes, for the sleep, that I think is probably the biggest. Again, sleep, I love sleep. I picked the wrong profession because babies don't come from 9 to 5, but I love sleep. And I think sleep is so important for function, right? For executive function. If your brain does not have rest, we cannot do the things that we need to do in the manner that they need to be done.
Mm-mm.
And so sleep to me is paramount and must be prioritized and protected at all costs. So if you're not sleeping well, there are some lifestyle things to consider. Um, First of all, everybody's favorite wind down glass of wine in the evening may make hot flashes and night sweats worse.
Ooh.
Yes, yes. And so if you have a glass or two of wine every night and you have horrible hot flashes all night long, it's worth trialing not having that and seeing if it makes life better. It may not.
We got a great big what?
Yes.
Oh,
So,
that's so funny. Oh, that's so funny. Wait, we're talking about wine, and I wore the appropriate shirt today. Gray hairs
there you
like
go,
wine.
right?
That's
Couldn't have
funny. All
planned
right,
that
so
better.
lay off the wine.
Right.
What's
So
next?
that is definitely one option. If falling asleep is a trouble like it is for so many of us, again, that may not be menopause related. That just may be life related. My general like good sleep health hygiene habits: avoid caffeine after 2 p.m. So no coffee, no tea, really after lunchtime. Um, the magic little boxes of light that we hold in our hands really need to get out of our hands at least 2 hours before bedtime.
Yeah.
That blue magic light has been programmed and designed and researched and tested to keep you engaged and awake and keep your brain addicted to looking at it. And I am no better than any of you out there in that I, fall into scrolling and mindless. But if you will turn off your phone and put it down and not stare at your screen, again, a solid 2 hours before you want your head on the pillow, you will fall asleep faster. I am a fan of giving your mind something to do when you try to fall asleep. That is not the laundry list of things that you are thinking about that you need to do tomorrow or that you should have done today or that maybe you'll get up and do before you actually go to sleep. And meditation is a great way to entertain your mind. I suck at meditating. I have tried to be a self-guided meditator for years now, and I am horrible at it because I can't keep it going. So I love the apps that give you a guided meditation because I will pay attention and listen to somebody because I'm a people pleaser, and even though I know they can't see me, I feel like they might know if I'm trying to cheat. So I love the apps. There's calm.com, there's Headspace. I have the Active app, which has it's a workout app, but they also have a series of sleep meditations on there that also sometimes also start with stretching, which I think feels really nice at bedtime. So
Which one are you using?
Active, AAPTIV. And they
Okay.
have like, I honestly started using it years ago for their elliptical workouts because I don't like running on the ground. But I don't mind getting on an elliptical, but I will just go like this and go very slow if nobody's telling me to speed up and go faster. So, it's all, it's beat based and they'll, tell you to pick it up and go with the beat and then double time it and things like that. So anyway, little plug for active, but they have yoga, they have sleep meditations, they have all these wonderful things. And so, and also like I think on Apple and Spotify, there's, like sleep playlist and things like that, but giving your mind something to do that is directed at relaxation, that is not, again, the laundry list of things that we should have done and need to do, I think is really helpful for trying to fall asleep. Melatonin is a great option for some people to help them sleep. The problem with melatonin, you don't take it at bedtime. If you take it at bedtime, it's not going to work. You have to take it, again, a couple of hours before you want to be asleep for melatonin to be helpful. For the average melatonin naive person, 1 to 5 milligrams is probably plenty. If you've tried it and have been using it wrong for a while, you may need to up the dose and use it appropriately. But again, taking that a couple of hours before bedtime is the key. That helps that kind of natural release, that helps time your natural release of melatonin to kind of tell your body to tune down and go to sleep. And then the other thing is to create a bedtime ritual. So just like you did for your babies when you were trying to sleep train them until their body said it was time to go to bed by taking a bath and then rocking the chair and doing the things, create that same ritual for yourself. I once read about sleep some things that there are only 2 things that you should do in your bed, and that's sleep and have sex. So don't hop into bed and read, or hop into bed and scroll on your phone, or hop into bed and turn on the TV, because all of those things are confusing the signals to your body that this bed is for 2 things only. Only. That's it. And then, of course, all the layering that we do to stay cool and hot and all of that kind of stuff. I think we've all probably been there, but fan on is, I think, super helpful for keeping your air moving. White noise is great for sleep as well, just to kind of, muffle the, you know, the dog next door or your own and the little kind of noises that go throughout the house. So again, the sleep to me is precious and is something to truly try to optimize. And so I'm big about that. When we think about the vaginal stuff, again, we kind of talked on the over-the-counter things earlier for just kind of day-to-day moisture as well as lubrication during intercourse. Again, I love me the coconut oil for that, and the over-the-counter replens and all that kind of stuff I think can be really helpful as well. When we think about the health risks, the things like bone loss and cholesterol changes, bone osteoporosis, bone health is something that, again, is very, very genetically predisposed. And so if your grandma was that little hunched over granny with a rounded spine and she broke a hip and she did all these things, then you're probably at risk for osteoporosis. From a standpoint there, the things that we need to do, make sure we're getting adequate calcium and adequate vitamin D. If you can find that in your diet, that's super great. If not, take a supplement. Caltrate D or any of kind of the over-the-counter combos are fine. Tums has calcium in it, so if you're a heartburn girl, a couple Tums before bedtime is going to get you your daily calcium quota there. And then a separate vitamin D supplement. That's what I do because I like Tums smoothie berry fusion. They're delicious.
That's funny.
They're
Reason to take some
right.
time.
That's right. They're candy. And then from a cholesterol standpoint, eating a high fiber diet is going to help get rid of that bad cholesterol. Exercise is going to help you build that good cholesterol, and exercise is going to be protective for our bones. And we think about exercise, weight-bearing exercise is where it's at. And so, truly pounding the pavement, getting out and walking, things like that, as well as functional strength training, building strong muscles to help maintain our balance and protect our bones and joints is really, really important. I think that weightlifting and strength training is probably the most important exercise that we can do in our 40s from a metabolic standpoint, again, from a protective standpoint as we move through life. So hit the gym or get a trainer or get an app and some hand weights and make that happen.
With that app, I know here lately, it's been a little over a month now, body weight strength training, because haven't been back to the gym yet, and also core Pilates has
Yes.
been
I love the
my
wines.
go-to
Yes,
here.
yes, yep, absolutely. All of those things, again, for your bone health, for your fall risk as we age, for that cholesterol. Yeah, lowering your heart disease risk, absolutely. American Heart Association recommends 150 minutes a week of exercise. So find that 150 wherever you can.
Movement medicine
Yes,
is what I
absolutely.
call it.
Yes.
Mm-hmm.
And from a mood and a stress and all of that kind of things, endorphins that we release during exercise, that is just a natural mood elevator. And I think also the whole reason I ever started exercising as an adult was because I did not have any me time. I was a busy physician with 2 kids and a busy husband. And I was at that point where I woke up and took care of my kids. I went to work and took care of people all day long. I came home and I took care of my kids. And the last thing that I wanted to do was anything to do with my husband. Because frankly, I've been helping and servicing people all day long. No, thank you.
Mm-hmm.
I was out touched and out, I just had zero time to not be needed and to not like, I was doing nothing for myself. And so we had kind of this come to Jesus, and I was like, I need you to find me an hour a week. We're going to start with 1 hour. And I need that time for myself. And so exercise for me started as a desperate plea for a long time.
Mm-hmm.
And
Mm-hmm.
this was obviously pre-COVID, but I started going to an exercise class, and my husband was like, I don't get it. You're going around people. I'm like, but nobody's talking to me. And I'm better now, but at that point it was a horribly bad at being self-motivated to work out. I was like, I'll get up and walk 45 minutes before work today. No, I'm not going to get up and walk 45 minutes to work today. I'm going to lay in bed. But again, I'm a people pleaser. So if I sign up and put my name on a list and an instructor expects me to go to class, and if I don't go, they go, well, where was Andrea Palmer this morning? She didn't get out of bed. How lazy is she?
It's all about that perception.
Right, exactly. No, and so I just use that to my advantage. And the other thing I stopped doing is I stopped waiting to not be tired to exercise, because that was always my thing. Oh, I'm too
Yes.
tired. I can't get up and exercise. I'm too tired. Well,
Yes.
hell, I'm always going to be tired. That's never going to get better. That was not ever going to get better at the the pace my life was at that point in time. So, yeah, exercise for mental health, for physical health is definitely one of my passion points, because it just makes the biggest difference in all of these things.
Absolutely. One of our viewers summed it up perfectly. Self-care.
Mm-hmm.
At the end of the day,
100%.
all about
Yeah.
self-care.
Yeah.
Mm-hmm.
And when you're doing all the self-care you can do and that's not helping, then you come see me and we can meditate.
Y'all make sure, if you do not have your own specialist, go see Dr. Andrea. Go see her. So what I'm going to do is I'm going to put your information up, and everybody take a snapshot, jot it down real quick. But what I'm going to do is take myself out and let you have final words for our viewers. Go ahead.
Okay. So to whoever was viewing and just said about self-care, I think that you have hit the nail on the head. Just like every time in our life, perimenopause kind of presents this unique opportunity for um, prioritization and really putting yourself uh, on the top of list of important things to take care of. If we don't take care of ourselves, no one else will. And having the excuse, if you want it, to go talk to a, a, a physician or some other professional about the things that you're feeling, about the things that are going on in your body. Perimenopause is the number one time that I see women they start off with a statement of, I haven't been to the doctor in 10 years and 15 years, many of them since their last kid was born. Maybe they had a tubal or their partner had a vasectomy, or they're not with a partner anymore, so they haven't needed birth control. So this gap between baby having and menopause is where women commonly fall out of routine well women checks, routine gynecologic care. And aside from all of the things of perimenopause, we have to think about like people haven't been getting pap screening and cancer testing in that time. So really, if you're one of those people who has not kept up with you because you're so busy keeping up with others, this is the time to kind of start reclaiming and reprioritizing your health. It's not only about the the pap smear screening and the mammogram and all of that kind of stuff that of course we're going to touch on when you come in for your wellness exam, but we want to talk to you about your mood. We want to talk to you about your relationships. We want to make sure that all of your life is functioning the way that you need it to work. And this is a time of social transition for many people. Well, as your kids are going and they're going through different phases, or maybe you haven't had kids, you want to talk about that. But this is just an opportunity for you to come talk to us. If you haven't been here in a while, take the time to make the pledge to come in and take care of yourself, because yes, self-care is something that needs to be a priority, and your gynecologist is part of that. So come see us.
Amazing. We had I'm squeezing in one last question because
Yes.
this question is excellent. Any thoughts on how to encourage conversations around this topic?
So I think just start bringing up the conversation. Like, you just have to ask the questions. I was listening to a podcast earlier, and it was actually somebody who was talking about the experience they just had with infant loss. And they lost their pregnancy. Their daughter was stillborn at 24 weeks. And, it was the male partner in the couple talking about how basically nobody talks about these kind of things. And menopause is kind of the same way. I always talk to patients about like the Hallmark card symptoms of menopause, which are hot flashes and night sweats. That's what everybody kind of jokes about. But all of these other things, all the vaginal symptoms, the mood changes, the sleep disturbances, these aren't things that are like talked about amongst girlfriends or with your mom. Again, like I think people older than us really kind of have a taboo about talking about all of these things. And so you just have to keep normalizing the conversation. This is life. This is body processes. These are just things that happen. And, speaking about them quietly or not in mixed company, we don't want the men to know. I think you just have to start having these conversations out loud and taking the stigma away from it, because it is stigmatized, right? It's just one more thing, telling women how we're not right, or that's not, so it's just keep having the conversations, keep normalizing it. And yeah, I think you just have to keep trying.
Mm, love it. Love it. And we will have you on as the resident doctor. Keep these conversations going.
Absolutely.
Hmm. Well, everyone, I thank you so much for tuning in with us. It's been amazing. Stay tuned for True to You Tuesday next week. And thank you for those of you that prayed. We had a family emergency yesterday. Everything's good. We ended up not having to take a hospital trip. So, yay, all under control. Thank you for your prayers. Sorry I missed you. And we shall see you next Tuesday. And in the meantime, until then, smooches.